a cardiac surgeon and an administrator in King Faisal University. I want in the beginning to thank everyone who invited me or make me to be a part of this initiative, Aspire, and I hope everyone will get benefit from these presentations and sessions about the residency programs in Saudi Arabia. I will talk about the cardiac surgery in Saudi Arabia, and I will go through some general objectives of the program, the entry requirements, the centers that is accredited for cardiac surgery, the duration of the program, the different rotations you have, and some also examples of the arrangement of the rotations. And at the end, the exams and the assessment tool that you have to go through. And also at the end, also you can answer a few questions if you have any. So as a general, what is expected from the program? The program is under the umbrella of the Saudi Council, and the vision and the view is to achieve, is aligned to achieve the Saudi vision of 2030. And for cardiac surgery specifically program, they, at the end of the rotation, or end of your training, they are expecting that the graduates will demonstrate knowledge regarding the cardiac surgery, demonstrate the ability to incorporate patient perspective and participate in research projects, deliver the highest quality care with integrity and honesty, exhibit appropriate personal and interpersonal professional behavior, and take part in continuing education for the upcoming generation to achieve the vision of the view of the Saudi Arabia 2030. This is the general expectation of, at the end of the cardiac surgery program. When you finish the program, this is what is expected and what we are aiming to achieve. So cutting shortly is about the entry requirement. The entry requirement, as I said, it is under the control and regulation of the Saudi Council, and the entry requirements go the same as for other programs. You have to obtain a Bachelor of Medicine and a Bachelor of Surgery from a university in Saudi Arabia, or any recognized university which is recognized by the Saudi Council. You have to obtain completion of certificate of completion of the internship year. You have an identity, national identity, passport, or residency, also residence. Sorry, and photograph, copy of your academic record, be medically fit, and pass the Saudi medical license exam, which is held by the Saudi Commission for Health Specialists. The grades for the Saudi medical license exam is variable. Each year is different. I tried to have a view about the last year grades with the minimal accepting grade, but they told me this is classified information, and they did not. The secretary did not give me this information. But basically, this is a must requirement for all applicants to Saudi to a Saudi program, including cardiac surgery. Okay, what about the additional discriminants, which will give you points, which maybe increase your chances in being accepted in the cardiac surgery program? As I said, this is additional. If you have this one, but you don't have the basic requirement, it will not benefit that much. So these requirement, the entry requirement, should be available in addition to these experiences and exams. And this is only an example. This is not limited to this list, like English language proficiency, like IELTS and TOEFL, years of experience in cardiac center, ACLS, research work, especially in regarding cardiac surgery, USMLE Step 1 and Step 2, ATLS, BLS, and basic critical care certificate, video game skills, which nowadays they found that people who are good in video gaming have better hand skills, a community initiative and volunteerism. All these will be additional points and might increase your chances being accepted in the program. The training requirement after being accepted, training is a full-time commitment. Usually, it will be involved in continuous and full-time training for entire training period, and it will be conducted in hospital, which is accredited by the Saudi Council, and the the responsibility will be the gradual progression of responsibility in the assigned rotation. So trainee will be actively involved in patient care, and each year you'll have more responsibility as you grow up during the program. And the regulation of all the program is, as we said, is controlled by the Saudi Council regulations and rules. What are the accredited centers in Saudi Arabia? These are the centers. Al Medina, we have the Al Medina Cardiac Center. In Dammam, we have the Saudi Al Babtain Cardiac Center. Jeddah, usually this is a joint program, so you'll be rotating in all hospitals: King Abdulaziz University Hospital, King Fahd Armed Hospital, King Faisal Specialist Hospital. Mecca, they have the King Abdullah Medical City. Riyadh, they have King Fahd Medical City, King Faisal Specialist Hospital, King Khalid University Hospital. Prince Sultan Cardiac Center. King Abdulaziz, which is the National Guard, now they are not accepting. And also this year they added Al Hassa, Prince Sultan Cardiac Center. They are accepting one resident, and they are now making the interviews. And as they told me, they will accept one. I'm not sure who's the one they accepted. So these are the accredited center, in addition to Al Hassa, which accepting one resident. Al Medina also one, they will accept one resident. Dammam one. Jeddah, they will accept 3 to 4. Mecca one. Riyadh, they will accept up to 5 residents. So what about the program itself? The duration of the program will be 7 years, and it is consisting of 2 phases. The first phase of the junior level, it will be 3 years, 156 weeks, because the training in residency is divided by weeks, not months. So it will be R1 to R3. And the second phase of the senior level or the cardiac surgery specific training will be 4 years, from R4 to R7. What are the rotations? This is the rotations for the first phase, which is the junior year. Will be first you will start with a cardiac surgery rotation for 12 weeks. This is a must to be started with. So you will know yourself. You will examine the program, the cardiacs. You examine yourself with cardiac surgery. This is going to be suitable for you, or from the beginning you can choose a different specialty. But it is not advisable, and it is not good to reach this point when you start the residency and then you change. When you start the residency, go through it, inshallah, and you will be very good. So you'll start with cardiac surgery for 12 weeks, and then this arrangement can vary. General surgery, 24 weeks. This is during R1, R2, and R3, and will be arranged according to the availability and your preference. But most of the people will do cardiac surgery 12 weeks, then general surgery. Research, they will delay it. Then cardiac surgery again, ICU, thoracic surgery as a junior, vascular surgery, trauma, which can be part of general surgery, cath lab, echo, and cardiac anesthesia, all part of cardiology. And this finishes your 152 weeks for the first phase or the junior level. Then you will go to the second phase, which is the senior level. It will be R4, R5, R6, and 7. It will be adult cardiac surgery, pediatric cardiac surgery, vascular as a senior, thoracic as a senior, and R7 will be cardiac surgery subsections. You choose if it is do you like it to be adult or pediatric, or can be mixed. mix of both. And this one will help you in deciding after you finish your program will help you to go through if you choose to go to pediatric subspecialty or an adult subspecialty. And for the vacation during each year from R1 to R7, you have 4 weeks of vacation. Additionally, you have 1 week of educational leave, and you have one Eid every year. So if you have Eid al-Fitr, then you will work on Eid al-Adha and vice versa. This is an example of the arrangement of the rotation. Most of the residents go through this one. The R1, they will go cardiac surgery 12 weeks, then general surgery 24 weeks, echo, research, and then the R2 will go trauma, thoracic, vascular, general ICU, anesthesia, research. And this example you can go through and you can find it in the booklet of the cardiac surgery. But it gives you an example of how the rotation are arranged and the preferred also. This is the preferred arrangement of the rotation, so you'll get benefit from each and every rotation. And this one is one example, and this is another example. The same, we start with the cardiac surgery in the first 12 week. Here the changes is that they are changing the general ICU here, and they are taking the CCU and cardiology during the second year, and the general ICU making in the first year rather than making the second and third year. During your residency, what about how do you being assessed, and what are the exams there? The assessment they're divided into two. In the junior level from R1 to R6, you have to achieve all these criteria. This one, which were accepted in the last year, it was not like this. It was shorter. The ACLS or BLS was not mandatory. Now it is, I think, mandatory according to the last year updates of the cardiac surgery program. So ACLS, BCLS, the 5Cs. This is this is an exam, online exam by the Saudi Council about the intensive care. And it was implemented with the beginning of coronavirus pandemic. Also, this one, Universal Topics Hours. This is an online courses. You have to achieve 20 hours to complete this one. To complete this assessment tool, you have to attend 2 research courses per entire residency from R1 to R6. And there is academic activity for cardiac surgeons with about half-day lecture. You have attended 75 of the academic activity attendance. Logbook, DOPES. This is a recently adopted assessment tool, which is direct observational, direct examination or direct assessment of your surgical skills. There will be an external consultant who is outside the center you are being training in, and he will come and he will evaluate you during operation. So you will be operating on a patient and he will be evaluating you. This is yet to be adopted, maybe started next year. ITER, this is the assessment. This is the assessment for every year. Every year you have to, for every rotation, you have an ITER, which is an assessment for your performance during that rotation. So this is basically what you have to achieve from R1 to R6. These ACLS and BCLS should be done once in R1 to R6. 5C once. Universal topic should be also done once. Research, 2 research courses per whole one, the 6th year. Attendance should be 75% of all years. Logbook will have an example of it later. DOPES, it is done usually in the senior years, your R5 and R6. And ITER, this is an evaluation will be done every rotation. For the R7, it is not much difference, but to enter the exam, the final exam, you have to have an ACLS, valid ACLS, valid BLS and ACLS. You have to complete the 5C, 20 hours of universal topics, 2 research courses, CPD, which is a case presentation, a case discussion and presentation. This is a part of your evaluation in the final year. They will give you a topic. You will go through it, see all the evidence, and then present it and discuss it with the experts. Attendance of the academic activity also should be 75%. You have to have a complete logbook, DOPS, and FITER, which is a special assessment evaluation form for the 7th year. This is the shape or the outlines of the logbook we are using in cardiac surgery program. For each year, we are specifying the number of cases that you have to cover, about 30 cases in the first 2 years, then 45 cases in the R3, R490, R5 180, and up to 180 in R7 also. The total will be about 735. This is not only operations, big operation like cabbages, valves, and surgeries in different specialty like vascular and thoracic. No, any procedure you'll do like chest tube insertion, evacuation of collection, whatever procedure, insertion of central lines, all are considered as procedures and should be counted. For the index cases, which is big cases, you have to see or to be part of 26 cabbages, AVR 7, MVR 5, and tricuspid valve 3. Congenital cases, about 11 cases. This is the outline of the logbook that you have to complete. What about the exam? Each year there will be an promotion exam, and to be upgraded or to be upgraded to the next year, you have to have at least borderline pass, which is about 60 to 69% borderline pass, or clear pass. If you are borderline fail, they will have some additional assessment tool to evaluate you and to see if you are a candidate to be upgraded to the next year. And what about if you have a clear pass or borderline pass, but you have missing assessment tool, which is we discussed before, this assessment tool, then you will repeat the year. These assessment tools should be all completed. In addition, you have to pass the exam, at least borderline pass or clear pass. This is for from R1 to R6. For the final year, which is after R7, the Saudi board final specialty, there is a written exam and there is clinical examination. Written exam will be consisting of 2 papers, meaning 2 exams, 2 written exams, each containing about 100 to 125 MCQs, total 200 to 250, and the passing score is 70%. And the clinical examination will be after you pass the clinical exam, you pass the written exam, and it will be 8 stations, each station 10 to 15 minutes. This is the last year, 10 to 15 minutes due to because of Corona, but usually it is about 20-25 minutes. And the station consisting of structured oral exam station with 2 examiners in each station. And all station will be consisting of scenarios, and you have to problem solving. This is mostly all about the what you are going to face during your training, and this is the resources or the box being used, which are accepted or suggested by the Saudi Council for the Cardiac Surgery. Mostly they are concentrating for the cardiac surgery training, Kirkland, and also cardiac surgery in adults by Cone. This is the 2 big books that are mostly quoted in training. But all these resources are useful, especially the online learning now because of the videos and the interactive sessions. CSATs about the self-assessment and thoracic surgery also produces a large number of questions and problems that will help you to assess yourself and assess your knowledge in cardiac surgery. This is all about the basic things that you have to understand, to know about the cardiac surgery program in Saudi Arabia. I tried to cover most of the points, most of the questions that been asked before. If you have any more questions, you are more than welcome.
دكتور، في واحد اسمه صالح الغامدي عنده أظن سؤال. تفضل صالح.
طيب أنا أعتذر دكتور إنه أول 5 دقائق تقريبا ما كنت موجود، فممكن أسأل سؤال يعني ممكن جاوبت عليه في المحاضرة. هل البروجرام في الرياض joint program ولا يعني per center؟
They are trying, آخر سنتين they are trying to make it a joint program. I'm not sure if they succeeded now or no. بس الحين they are doing it by another way. They are doing the rotations. يعني you are trained, if you are assigned or you are choosing King Faisal Specialist Hospital, they are making now rotations outside the King Faisal. You do it in the Prince Sultan or the University Hospital or مدينة الملك فهد الطبية to cover up for the يعني more exposure and mimicking joint program. دكتور فريد خوغير he's trying السنة الماضية أو اللي قبلها قال إن they are planning and they are يعني they did big قطعوا شوط طويل في الموضوع هذا، فما أعرف إذا من السنة الجاية راح يكون joint program أو لا.
تمام. طيب دكتور، إيش أفضل المدن في السعودية أو أفضل السنترز يعني في الكاردياك سيرجري ريزيدنسي؟
السنترز كلهم كويسه من ناحيه البيسك تريننج، بس انه يفرقون في مساله الفوليوم عدد الحالات اللي ممكن to be exposed to. طبعا الرياض السنتر هي اكثر، هي يعني more exposure, you will see more cases, large number of consultants at the same time. يعني مثلا في البريفري راح تشوف في الهوسبيتال ممكن في 3-4 consultant، بينما في مستشفى زي التخصصي راح تشوف فيه 8 consultant or more. فهم they are good, all good, but the difference is the volume. الفوليوم طبعا في السنتر hospitals خاصة في الرياض is better.
دكتور، في عدة أسئلة في الشات. في واحدة تسأل ليش البروجرام في السعودية 7 سنوات وفي أغلب دول العالم 6 سنوات؟
ما أعرف، بس إنهم اجتمعوا أكثر من مرة على هذا الموضوع. فيه ناس كثير against إنه يكون 6 سنوات وفي ناس معه، لكن الملاحظ والواضح إن الناس في التصويت للناس اللي يبون 7 سنوات أو يشوفون إن التريننج في السعودية يجب يكون 7 سنوات كانوا أكثر.
طيب في سؤال آخر، هل فرصة الجراح العام اللي أخذ بعد الجراحة العامة 2 جراحة قلب وعنده بوردين فرصتها بالشغل أفضل من فرصة اللي عندهم بس بورد جراحة قلب؟
الحين في الوقت الحالي مسألة التخصصات you are not and you will do the what are you specialized in. إذا حتى لو كان عندك general surgery program بعدين كملت أنت الفيلوشيب حقتك على cardiac surgery مثلا في أمريكا you will work as a cardiac surgeon، ما راح تسوي شيء في الجنرال surgery. فالchances الحين all the hospitals هنا وبرا they are concentrated, the physicians they are more specialized. الحين بعدوا عن مسألة إنه يكون الفيزيشن يسوي كل حاجة. الفيزيشن is specialized in a certain specialty، يعني he is a cardiac surgeon, he will do cardiac surgery. يعني ما راح يكون cardiac surgery وعنده في الأيام يسوي والله يغطي rotation general surgery. So the chances are the same.
من وجهة نظرك دكتور، شنو الأفضل؟ أخذ البورد السعودي للتخصص أو أخذ البورد الأمريكي أو الكندي كتعليم؟ هذا أحد الأسئلة أيضا.
طبعا البورد السعودي الحين still a new program, still we are building it, they are building it. أنا لسه مش معاهم. They are building the program. البرامج الأمريكية والكندية they are structured، لهم سنوات كثيرة وعندهم more experience في التريننج. فإلى الآن أكيد المخرجات راح تكون أو ممكن نقول إن التريننج راح يكون أسهل عليك وعليهم في الاوتسايد programs especially اللي هم النورث امريكان طبعا because of the long experience more exposure. السنترز حقتهم الفوليوم فيها جدا عاليه.
Doctor, what are the pros and cons of cardiac surgery as a specialty for you?
Pros and cons for it is a surgical specialty for the one who loves surgery. It is a very great, and you will enjoy surgery. You feel the joy. Oh, sorry, when you save lives, when you treat patients, when you stop the heart and then make the heart function again. This is a joy for the surgeons in helping each other, in helping other patients, in helping the patients. But all the medical field will help the patient, but this is a surgical side. The cause of the surgery, it will take time to master the cardiac surgery. There is too many developments, too many progresses in the catheter-based intervention. So you have to keep up with these things. Every day is a challenge. You have to be open to new techniques and new guidelines every now and then.
Okay, thank you, Doctor. A question is, what are the sponsor options to study abroad?
I'm not sure السبونسر بس أنا عندي comment على مسألة السبونسر. When you are choosing a sponsor, نصيحة مني choose a sponsor who have a hospital and they have the cardiac surgery already available in the center. ما أعرف إذا كانت البعثات الملك لا زالت موجودة بالنسبة للابتعاث بالنسبة للسيرجري الكاردياك سيرجري أو لا. المستشفيات نفسها the hospitals they are providing sponsorship مثل التخصصي عندهم scholarship والحرس الوطني عندهم في الرياض عندهم scholarship بس ما عندهم training عندهم scholarship. وبرضه في المراكز التخصصية زي بن سلطان في الرياض في جدة أتوقع عندهم برضه scholar بالنسبة للكاردياك سيرجري.
جميل دكتور. What are the skills that should be in any cardiac surgeon?
Hard work. You have to be a hard work, and each and every skill that you will see or you heard of, you will get it when you are a hard worker. Because the skills in cardiac surgery are cumulative. It's not ما هو شيء يجي من السماء يعني كذا على طول. يعني هو gift من رب العالمين لكن لما يجيك كذا ان انت تحلمت ان عندك skill يصير عندك skill by hard working training and if you are gifted it will be easier for you to keep up and to improve your skills. So the most important thing بعد توفيق الله سبحانه وتعالى انه يكون hard worker and the skills will come with time.
Doctor, as a student, what exactly can we do to make sure that we are choosing the right specialty as if we are choosing cardiac surgery?
Okay, as a student, the most exam أو exam نقول إيش testing point for choosing cardiac surgery is to do cardiac surgery. So during your university year or the college year, you have to have rotation with cardiac surgery and see the daily life and the cardiac center life. If you feel that you can do this and you feel that you are comfortable, you feel that you want to wake up and go to the center and do your job, this is the right specialty for you.
Okay, thank you, Doctor. Someone is asking about your email, Doctor. If you can write it in the chats or send it to me and I will write it to them.
I will write it down.
Doctor, I have a question about what do you think that, and I heard many cardiac surgeons says that there is no life balance in cardiac surgery or that your life is your specialty in cardiac surgery or such phrases. What do you think about that, and what's your experience in this area?
If you are a busy cardiac surgeon, yes, you cannot balance. But if you are not busy, if you do few cases, then you can balance, sure. But if you are interested in your specialty, you like your specialty, you want to build a name, you want to help other, you want to expose and explore this specialty, you will not find the balance. Many times that there is things that you want to attend to, go to, or any social things that you have to attend, but there is other thing which you feel inside that you have to do in the hospital or in the operating room, and so you will choose that you'll go to the operating room, not to the social event. So if you really eager to explore this specialty, yes, you will not find balance.
دكتور، احنا دائما يعني احنا كطلاب ما عندنا التصور الكامل لمسألة البالانس اصلا في الحياة بعد 2 3 او اكثر. يعني كيف يعني لما الناس تقول ان انت يعني busy all the time, can you tell us a story or experience you had؟ يعني مثلا ممكن شيء احنا يقرب لنا الصورة كيف الواحد
you are a consultant, you are responsible, and you are responsible about the patient. So for example, say you do the surgery for the patient starting in the morning on Sunday, so starting in the morning 8:30 maybe, and then you finish at 2. The patient after the OR will go to the ICU, will be monitored for the hemodynamics and chest tube outputs. So patient will be still intubated and the ICU. This period is very critical period. You might go home, but there is a chances that the patient needs to be sent back to the OR for any complication that may happen. So during that time, during that time, your mind will be always concentrated about that patient until this patient is totally stable and the patient is shifted to the ward. And even if the patient shifted to the ward, still you are concerned about any arrhythmia or any problem that might occur to the patient in the hospital. So you all the time will be concerned about that patient, and you have to be around the hospital within 15 to 20 minutes if there is any major problem, that the on-call physician can help you, but you are the main responsible for that patient. So you have to be there. And it's make this is only about one patient. So consider if you have per week you have 4 or 5 patients, so it will be a burden on you, because you are connected to the hospital. You have to be there for your patients, and sometimes you have to sacrifice great moments with the family to go to see a patient and save him. I hope this example can.
Yes, it is very clear. Yes. Salih wants also to ask a question. Yes, Salih.
طيب دكتور، انا بصراحه شايف في اختلاف في البراكتس. يعني حتى في السعوديه هنا في مثلا مستشفى تخصص في الرياض ما شاء الله بيعملوا اغلب الحالات روبوتيك و مينيمال انفيزيف كاردياك سيرجري. في مستشفيات ثانيه زي مثلا العسكري هنا في جده، لا اغلب الحالات يعني اللي هي الكلاسيك كابج وبليسمنت اوبن هارت سيرجري. في مثلا عندنا في المستشفى الجامعي في جامعه الملك عبد العزيز بس يعملوها كلها اون بامب، ما في عمليه اوف بامب. فاحس في اختلاف في المراكز يعني. فكيف شايف المستقبل؟ يعني هل الامور كلها رايحه على روبوتيك من الانفيسيف وزي كذا؟
هي الامور رايحه للليس انفيسيف. يس. how close is this؟ يعني متى راح يكون؟ I don't know. But robotics, catheter-based intervention زي TAVI will also mitral clip. All these are in the near future, and you have to be able to do it. إن حتى في كثير من البروجرامز اللي في North American now it's part of their training, and even here in Saudi Arabia they are trying to integrate these advances also in the cardiac surgery program. Many of the cardiac interventions now the catheter-based intervention are now done by cardiac surgeon. في الشرقية عندنا مثلا دكتور فهد مخدوم. He's doing TAVI and he was the director for many years for the TAVI. في الغربية عندكم عثمان العثمان يعمل also interventions عن طريق catheter-based intervention ومينيمال invasive. في الوسطى ما شاء الله كثير منهم يعملوا interventions يعني في catheter-based. الروبوتيك اكثر شيء يسوي دكتور فراس خليل. الاذر سيرجنز هم اقل شوي منه في الروبوتيك. هو شوي more interested in the advances while the older physicians are more concerned يعني عندهم الاوبن surgery still. ف as a resident you have to keep up with this advances. Is it the future? Is it the future? Yes, it is the future, but it is not the only future. But the classic surgeon who's doing cabbages only and doing simple mitral and simple aortic valve, in the future it will not be it will be ما هو شخص مثلا ما هو الكاتش ممكن انه ما يحصل فرصه كثيره. الكاتش هو في الفيزيشن في السيرجن who's updating himself. He's growing up with the advances, robotic, minimally invasive, catheter-based intervention كلها. It is the future, but it is not the only future.
شكرا دكتور، جزاك الله خير.
دكتور بخصوص الفيوتشر، أنا سمعت كثير دكتور ناس تتكلم إن if you love open surgeries go into pediatric and it's still gonna be why is that?
Still no pediatric surgery. Still there is many surgeries that are not tackled by the intervention, but there is also advances. Now many of the most of the ASDs are closed transcutaneously. They are starting with the VSDs. They are doing now more complex procedure by cardiac intervention, but still surgery is the main of treatment. But for some cases and for other cases, for example coarctation, now the cardiac intervention, they are the one that it is the option number one for the intervention. So even for pediatric, there is advances in the catheter-based intervention. And a good surgeon, also a good pediatric surgeon, will adapt to this one and will be integrated and update himself with this interventions.
جميل، الله يعطيك العافية دكتور. إذا في أحد عنده سؤال أو استفسار.
Okay, I think إني أجاوبت على كل الأسئلة اللي سألتوني إياها. If there is any more questions, you are more than welcome to contact me on my email. إن شاء الله everyone will choose the right specialty for him وتوفقون إن شاء الله في المستقبل. يعطيكم العافية.
الله يعافيك، شكرا جزيلا دكتور على وقتك وجهدك. نشكر الحضور جميعا.
الله يعافيك، وشكرا يا سيف على هذه الفرصة.